so mean. How are you not crying?
I'm trying, and now I'm thirsty.
Why does Carly always need water? Why is this so sad? Hey there, I'm Rachel. I'll be your nurse practitioner today.
Hi, nice to meet you. I'm Carly.
All right, Carly, what brings you in today?
I've just been having a lot of weird symptoms, and I feel like it was time to come to the doctor about it.
Great. What kind of symptoms have you noticed?
I've been having a lot of symptoms that deal with dryness. So my skin has been really dry. My eyes have been dry, especially in the sun or in the morning. And also my skin has been crazy dry.
Okay. How long have you noticed the dryness?
Probably for about a year now.
A year. Does it ever feel like there's something in your eyes?
Definitely. It kind of feels like gritty or sandy in my eyes.
Okay. What have you done that has helped with the dryness?
I try to put eye drops in throughout the day, but I've had to stop wearing my contacts, so now I'm mostly wearing glasses, except for right now. So that's about it in terms of dryness, besides lotion for my skin.
Okay. Have you noticed any changes with being able to spend time outside?
Yeah, I definitely have to wear more sunscreen now, and I tend to get sunburn a lot easier, and I get a lot of dry skin, especially with the cold weather coming about.
Okay. Are there other ways that you've had to change your regular life?
I can't clean my house as much because fluffing up the dust tends to affect my throat and my nose and tends to get in my eyes and irritate my eyes. And I've also had to retire early because I just feel so tired and fatiguey all the time that I couldn't go to work.
And this says you're 43, is that right?
I am, yes.
Okay, great. So what kind of foods have you had to avoid or?
Things that make my mouth dry, so I can't enjoy like salty or spicy foods and anything acidic like special fruits or any alcoholic beverages of the sort.
Have you had any nosebleeds?
I do. I have nosebleeds probably about weekly.
Okay. And has it interfered with your sleep at all?
Definitely.
Any of the symptoms?
Definitely. I wake up in the middle of the night coughing and then just kind of itching because I'm so dry. And so I don't sleep very much at night, and I think that attributes to my fatigue.
So we're going to start by getting a blood sample, doing some labs, and then we'll move on to some diagnostic tests as well. We're going to want to test how much saliva you're producing, how much tears you're producing. We also might do some imaging using either a CT or an MRI.
Okay.
Does that sound all right?
I think I can handle that.
Great. So we'll get you over to the lab and get you started on those tests.
Can I get a glass of water?
Oh, sure. Okay, I've got my graduated cylinder and my sterile filter paper strips. I've got my order. Hey Carly, how you doing?
A little nervous.
Yeah, well, nothing that we do now is gonna hurt. You already got your blood drawn. We're just gonna do these two tests, okay?
Okay.
The first one is a salivary hypofunction test, which just means we're going to check if you're making enough saliva.
Okay.
So to do this test, I'm going to hand you this graduated cylinder, and instead of swallowing any of your saliva for the next 15 minutes, I'm going to have you spit into this cup.
Okay. I think I can do that.
Okay.
Should I start?
Sure.
Okay.
I'll start a timer. Okay, Carly, how you doing?
Not so hot.
Ooh, too low. All right, so the other test we're going to do is going to be looking at your tear production. And for this, I've got some sterile filter paper, and I'm going to be placing it just inside of your eyelid, all right? It's not going to hurt. It might be a little uncomfortable.
Okay. Did you sterile glove before this?
Of course. I did hand hygiene and I have my sterile gloves on. You can just press your eye closed. Great. Now I'm going to open your other eye. All right, and you can close your eyes and just try to relax, and we'll leave those in for about 2 minutes. And we'll come back and check them, okay? All right, I'll take these out of your eyes now. Perfect. And we're going to measure them against our measuring stick Oh, too dry.
Okay, bye-bye.
So we've got some of your results.
Okay.
It looks like you have a condition called Sjögren's syndrome. It is not life-threatening. It basically means that your salivary glands are a little bit drier than normal, which will explain your dry mouth and dry eyes.
Okay.
The ways that we tested that, we did an anti-nuclear antibody test, which is positive in about 70% of Sjögren's patients. Yours was positive, so that points to it. We also did a rheumatoid factor. It's another antibody test. It tells you that somebody might have a rheumatic disease like rheumatoid arthritis or lupus. It doesn't tell you which one, but it will also be positive in Sjögren's syndrome. Yours was also positive.
Okay.
Some other tests that we did that help point to Sjögren's are the SSA or a row lab, as well as an erythrocyte sedimentation rate. That just shows us that you're having some sort of immune response or an inflammatory disorder, which Sjögren's is that, and you also tested positive for that. Similarly, the immunoglobulins was a little bit elevated, which we expect in somebody with Sjögren's.
Okay.
I know you also did the Schirmer's test, where we measured how moist your eyes were, how much tear production you had, and yours was very low, which is a major symptom of Sjögren's syndrome. Similarly, the salivary test, you also had a low output of saliva. So all of these symptoms and lab results, diagnostic tests point to Sjögren's syndrome. We'll focus our treatment on keeping things less dry. So we'll give you some prescription eye drops that will help there, and we might also do an MRI or a CT to look at your parotid glands to make sure there's nothing that we're missing. You're in the prime age group of people who get Sjögren's, between 40 and 50, usually about 9 times more common in women, so you fit all of the regular characteristics of who would get it. Like I said, it is not deadly. The only risks that we have that are associated with it, one is you're at a slightly higher risk for lymphoma.
Okay.
You're also going to want to make sure that you continue to see your dentist regularly.
Okay.
Your saliva is really helpful in keeping your mouth healthy and preventing cavities. So without enough saliva, it's going to be really important to make sure we're monitoring for cavities.
Okay.
What other questions do you have right now?
Is there a chance that my children would get this, or that my sister, or
Yeah,
any
I'm
of
really
her?
scared too.
Yeah, they don't exactly know what causes it at this point. There could be a genetic component, but it's unclear. So at this point, they don't think that anybody in your family is at a higher likelihood of getting it.
Okay.
How much will this cost to manage her symptoms? She's my only sister, so
Yeah.
I really want to keep her healthy.
I know financial burdens of medications can be really daunting. Luckily, this one is not too expensive, probably around $1,000 a year for medications, and I imagine that you've already been spending about that much on over-the-counter medications.
Yeah.
So we'll just get you some slightly better ones for the symptom management so that you don't have to keep
Okay.
running to the store. But otherwise, the only costs are continuing to see your providers and staying on top of your labs and things to make sure nothing else comes up.
Okay.
As far as your skin, I know you said you were having dry skin, which can be related to Sjögren's. It also might just be that you have dry skin. So a few recommendations about that would be take warm instead of hot showers.
Okay.
And when you get out, if you can let yourself air dry, you'll actually absorb more of the moisture so that you don't feel as dry.
Okay.
And then we'll get you some lotion recommendations as well.
Really good to hear.
Great. Well, it was
Thank
nice
you
to
for
meet
your
you
help.
both.
Nice
I'll
to
get
meet
those
you.
Thank
medications.
you.
Have a great
You
day.
too.
Oh my God, I'm
Ooh,
so
I'm so
relieved.
relieved.